What's up, guys? Dr. Matt, and I wanted to come on today and talk to you a little bit about breathing and why, if you're someone who has chronic nagging aches and pains, be it lower back or shoulder or neck or hip or whatever it may be, why breathing is a very important thing for you to consider and why that may be a really helpful thing for you to start working on to get you moving and feeling better for the long haul. I want to use a balloon, a coffee cup, and a larger bowl to kind of demonstrate why that matters. But first, we'll kind of talk through a little bit about the mechanics of breathing. And so when we think about the mechanics of breathing, just like any other joint in your body, there has to be a certain level of motion that occurs through our rib cage and our spine to accommodate the expansion of our lungs to pull air in efficiently. If the rib cage and the spine cannot expand to allow airflow to occur into the lungs or to allow the lungs to expand, we're going to start compensating in some way to actually start getting air in. And this becomes really relevant if we're working hard, we're running, we're squatting, you're a CrossFitter, whatever it may be. A lot of these compensations are going to start to come out as we start to work harder. And so when we think about the movement that needs to happen, it's not about bringing air down into your low belly. It's not about bringing air into your shoulders. It's not about breathing anywhere. It's really about finding where you need to breathe and where you need to focus to allow the lungs to expand most efficiently, to allow airflow to actually occur. And so a lot of people like to talk about this idea of belly breathing, and it's not about belly breathing. We want more of what we call a 360-degree expansion, meaning my belly, my sides, my low back, everything's expanding in 360 degrees, and it works its way up in a wave-like fashion. And so we call that the breath wave. And so we have a muscle called the diaphragm living up in your chest. When we take a breath in, that diaphragm essentially pumps down to pull air in. And what happens to allow that expansion to occur is your ribs here, they start to spread out like your fingers here. Those ribs then start to kind of move outwards, and then that expansion works its way up into your chest, into your upper back. So we get essentially a full expansion of this entire canister from your neck all the way down to your pelvis. Okay? If we cannot expand the rib cage appropriately to actually allow that air to occur, we're going to start compensating in some ways. And so we can actually use the coffee cup and the bowl and the balloon to kind of explain or demonstrate what may happen. And so if we take a coffee cup and we take the balloon, so the coffee cup will represent how much our rib cage can actually expand. The balloon will represent how much we're able to expand against that rib cage. And so if I take this coffee cup and I blow up my balloon, that, if I could get it out of the cup, that's all the expansion I'm getting, even though clearly this balloon has a lot more room to expand. So the dynamics of my rib cage are limiting my ability to expand my lungs and get air in efficiently. And when that happens, we have to compensate in some way to allow us to continue to maintain our capacity. What generally ends up happening, especially in a lifting or an athletic population, is when we run out of room to expand or we get fatigued, if we can't get that 360 expansion, we're going to go to what we call an extension compression stabilization strategy. And what that means is all of a sudden I'm taking a breath in, I run out of room, I can no longer expand 360 because my rib cage will not expand or allow expansion to occur. So I've got to continue to breathe in to continue to sustain my workout. I'm going to go into lumbar extension. And what happens here is now my low back is starting to help pull air in. My neck, my chest, everything up here is starting to help pull air in. So a lack of ability to expand your rib cage appropriately can directly contribute to low back pain, neck pain, mobility issues, whatever it may be. Now, the cool thing is through some very simple exercises, we can actually start to improve the dynamics of your rib cage and your spine to allow more expansion to occur and allow better movement. And so through those exercises, all of a sudden we have a rib cage that can now expand to the size of the bowl. When I blow up my balloon, all of a sudden I've got a lot more capacity, a lot more ability to expand my rib cage without having to cheat and compensate when I'm working out. And ultimately that's going to improve my capacity and improve my ability to work out and do the things that I want to do without cheating, without pain, without aches and limitations. If you have any questions on that, you need some help, shoot us a DM, let us know. We're happy to help you. Take care.